A record 26,485 people have tested positive for the coronavirus in the past 24 hours. Professor Adrian Puren, Acting Executive Director of the National Institute for Communicable Diseases, joins me to analyse the numbers. A very good evening to you. I mean, other than deeply disturbing, what does it say is happening?
Well, I think for now, Gauteng still is the core of what's actually happening in terms of the numbers, and of course Western Cape. There are certainly increasing numbers in the other provinces, and although not to the same extent as is currently seen in Gauteng, but I think we may well see in time that geographically the events that we are certainly seeing in Gauteng and possibly in the Western Cape we may see in the other provinces. But this is an important time for those particular provinces which are not seeing the extent of the increases to really be prepared, especially in the context of the Delta variant. This is a variant that is highly transmissible, and we've seen that in India, the UK, the United States, and in fact other countries where even there are high degrees of vaccination, that in fact the Delta variant is the dominant variant. So I think we need to be concerned, and we need to be focusing on getting our provinces ready. I
was thinking about this earlier, and I read I didn't know why this is the case. I mean, do we know why it is so easy to transfer from somebody to another when it comes to this variant?
Yes, so the transmission routes are the same. That doesn't change. It's the nature of the virus. In fact, the mutations have given rise to particular changes in the proteins of this particular virus, or this particular variant that allows for rapid transmission, binding, and entry. So that's the major reason why we're certainly emphasizing the need for, and as you know, we are in a readjusted lockdown, essentially to minimize contact. That's the key part to this, is essentially to minimize contact, to be wearing your mask correctly, to keep the physical distancing as best as possible. That means, again, even at workplaces, restaurants, malls, all those particular regulations that have actually been introduced are for that specific reason to limit contact.
Okay, but I mean, does that matter? You saw the EFF march last week. You saw what's happening at Nkandla at the moment. It doesn't seem as though anybody cares. So as much as we stay at home and try to do the right thing, what sort of impact does that have?
This again comes back to the fact that we need to, as I keep on emphasizing, it's a matter of engaging communities, but also the fact that we need to be enforcing and engaging with those individuals who, when you read through that Gazette, it's pretty clear that if those events do occur and you're aware that this is in fact is breaking the law, that there should be enforcement.
All right, and as far as the vaccine is concerned, I mean, wherever you go, you just see queues of people desperate to get their vaccines. Are we getting enough to quell the spread?
Well, I'm hoping that the rate of vaccine delivery in the country will certainly increase and expand in order for us to be able to deal with, for example, especially the vulnerable individuals above specific ages and comorbidities, get that particular vaccine. I also hope that vulnerable groups such as the healthcare workers have received their vaccine, and so we should, at least in that particular group, certainly see a degree of protection. In other words, we should see less individuals becoming infected in the healthcare workers. If they do become infected, which they certainly will, because not all the vaccines are efficacious to 100%, that means some people will be infected, but they are certainly having disease course which is mild or does not lead to hospitalization. But you're quite right. An expanded vaccine program is really critical for us.
What are you hearing as far as hospitals are concerned? Obviously, we get all the disturbing stories. What's the reality on the ground?
Yes, so I think certainly in Gauteng there's certainly a great deal of pressure when we look at some of the data. So again, there are public available reports, so you can certainly keep up to date with what the extent of the hospitalizations are. So certainly the beds are under critical pressure at this particular time, especially in Gauteng. And I'm sure currently in the Western Cape something similar is going to happen if it's not happened already.
I know this is a first for us, but if you look at the spike that's happening in Gauteng and other parts of the country, any idea when the spike will start to abate, when the numbers should start dropping?
Yes, I think it's very difficult to predict some of this. I think the waves are predicted to last 5 to 8 weeks. So I think if we are into week 2 or 3, then we may still have another few weeks to go. Hopefully we'll have a rapid spike, but unfortunately that means a rapid spike means really substantial numbers, which we have already. But the implications of that are obviously, as you've asked, is the pressures on hospitals in terms of the bed capacity, IC capacity, oxygen capacity. And so again, when you read some of the headlines of people not being able to make it to hospital and so forth, that's going to be our reality.
Terrible.
If we don't really adhere to those regulations. Those regulations are there for a reason. They're based on good scientific foundations. We should try and adhere to those regulations.
Exactly. Adhere to them. Get the vaccine when you can. Adrian, thank you.